Hi, my name is Ethan Barton. Today I'm going to be performing my CVAD checkoff. Here is my ID. Now that I've shown you that, I'm going to scan the room. As you can see, I have tried to use the Panopto setting on the computer to record. However, it was not working, so I'm having to use it to prop up my phone. Okay. So now that I have the camera positioned, I'm going to get my patient care order form and verify my hospital policy for the see that it requires a dressing change. So after I've done that, I'm going to make sure I have all my equipment available, and I do. All right, now I'm going to move the camera to look at my patient, Mr. Jaguar Jones. I'm going to use, first I'm going to perform hand hygiene before I would touch the patient, and then I would look at his armband, see that his date of birth is 8/25/1963, verify that on my care order form right here. Also verify his medical record number is 4176352, and I'll also see that his medical record number is 4176352 on the patient care order form. After done that, Mr. Jones, today I'm going to be cleaning your central line dressing and putting a new dressing on. And then I make sure I have all my equipment gathered. I would also make sure that there's no allergies. I see that he has an allergy to penicillin on his patient care order form, and that is present on his armband as well. So after I've done that, provide privacy for Mr. Jones. I'm going to turn this box back like this and then move my camera. So now I'm going to assess through the tegaderm. So get where you can see there. Assessing through it, and I'm also palpating around the insertion site. So after I've done that, I'm going to move the camera again, and then I want to make sure that my bedside table is placed closest to the patient, and that is nearest to the site. I will also make sure that my work table is at waist level or above, so I will not be breaking sterility. My space is not above waist level, however, at this time I'm going to say that it's below waist level, but it'd normally be above waist level. Then I'm going to position my trash can and perform hand hygiene. Now I'm going to raise the patient's bed to working height, lower the side rail, and position the patient comfortably with a pillow behind his head to keep his head elevated. After I've done that, I'm going to remove my kit. I'm going to move the camera so you can see. Open it away from me. Then I'm going to get the patient's mask. Place it on the patient. Remove the camera so you can see. Now I'm going to don my mask and goggles. Now I'm going to turn the camera where you can see again, and I am going to move this so you can see. Stabilize the catheter with my left hand, and then pull away towards the injection site while removing the tegaderm. Make sure that the biopatch is removed with the dressing. I'm going to crumple that in my hand, and then I'm going to assess this site. I'm looking for any signs and symptoms of complications. And also, if I needed to obtain a culture, if there was any exudate seen, which is a sign of infection, if I need a culture, I'll then obtain that now. So after that has been done, I'm going to dispose of this dressing in my gloves. Downwards towards the trash can. I'm going to move the camera so you can see. And after I've done that, I'm going to perform hand hygiene. Next, I'm going to open the rest of my kit. Trying to get this so you can see. Noting the 1-inch border. Also, it should be at waist level or above, and anything off the table is considered unsterile now. So after I've done that, I'm going to don my sterile gloves. I'm going to position the camera so you can see. I'm going to break sterility and move the camera. Now I'm going to organize my supplies on my sterile field, staying away from the 1-inch border. All right, once I've done that, now I'm going to cleanse the site with an alcohol swab. So I have my alcohol swab right here. I'm going to dispose above waist level. Then I'm going to break sterility, turn the camera so you can see me cleaning the site. Okay, so now that I have that set up for the camera to see, I'm going to clean around the injection site, circular motions, getting farther and farther away from the injection site. Then after I've done that, I'm going to dispose in the trash can above waist level. I'm going to break sterility again and turn the camera. Then I'm going to get my chlorhexidine. I'm going to break it, you'll hear a click. I'm going to move the camera again. And then I'm going to clean, broken it. Now I'm going to clean vertically. I'm picking up the catheter above the green hub, horizontally. And I'm also going to clean the catheter all the way up to the green hub. I'm doing this for 30 seconds. After this hand is now contaminated. And now I'm going to dispose above waist level. And now I'm going to let it dry completely before I would apply the bio patch. I'm going to move the camera, break the sterility again. I have my bio patch. Then I'm going to move the camera once more. And I'm going to apply it with the blue side facing up. Once I've done that, I'm going to place it back down. And then now I'm going to break sterility again, turn the camera. I'm going to get my tegaderm. Now I'm going to remove the outer portion, dispose above waist level. I'm going to move the camera again, and I'm going to make sure you can see. So I'm going to apply it all the way over the green hub of the site. And then removing the outer part of the tegaderm. And then I'm going to keep this part of the tegaderm right here, this label. And then I would place it on the dressing and write the date, time, and my initials for the dressing change right here. And then after I've done that, I'm going to move the camera again. I'm going to dispose of my gloves, downwards towards the trash can, moving my goggles, as well as my mask, and also removing the mask of the patient. After I've done this, I will be, I'm going to raise the side rail of the patient. I'm going to make sure the patient is positioned comfortably. Over moving the camera, position the patient comfortably. I'm also going to lower the bed to its lowest setting and make sure the call light is available for the patient. And now I'm going to turn the camera again, dispose of all of my equipment. Now I'm going to perform hand hygiene, and then for my documentation points, I would document the site appearance and any drainage that I found, the characteristics of it, if there was any cultures obtained, as well as the type of cleanser used, the type of dressing used, how the patient tolerated the procedure, and then I would put the date, time, and my signature on the documentation. And that concludes my CVAD checkoff.